Very good.
Give it a little click.
Nice.
So this little one isn't going. And I really like to assess like each joint right here, like right at that first joint. What's really great about the toe bones, if you look on an actual anatomical chart of the skeletal system, you see all these little digits are kind of flared inwards. It has kind of an hourglass shape of each digit. And the amazing thing about that is your fingers, right? So you got the concave and the convex, and they fit in there perfectly. So it's really great. It's almost like we're made to massage each other. And by evolution, creation, or design, either or. You can just check them all. So if I'm putting it down this way, is that making the 90-degree angle?
Yes.
Yeah, pretty much.
Is it?
Yeah,
If it
not
was
really.
90 degrees, it'd be pointing straight down, wouldn't it?
Oh, right, yeah.
So yeah, maybe like 60 degrees or something. So yeah, we can assess there's a lot of tightness on the underside. So this would be the Achilles heel band from these three toes. So on the exhale, inhale, give a little bit of relief.
Yeah.
Next breath, go a little deeper. There we go. Give a little wiggle.
Are you just pressing down on that?
Straight down, yep. Exhale, inhale, exhale. Now, if it's not letting go, right, then you have to go back down to the roots, to the tips. So, you know, I would get my chopstick, which we're going to learn in the next few days, and really do a fine job, like right here. And then, as well as the big bands that you see on the charts here, there's also these micro bands. They're just like the root system of a plant that branches out to more and more and finer. Same thing with the tension in the toes. So you can find all these different micro bands in the toes.
That's why the tools are good, isn't it?
Yeah, but I can feel it, but you can
That's the
see.
spot.
Yeah, right? So you just kind of, what I do is I try to like think of each toe or finger in terms of a compass. You've got the north and south, the east and west, and then you've got the diagonals. And if you've got your little pincer grips happening, you actually get both. Top and bottom, north and south. Left and right, east and west. And then you can go at the diagonals as well too. Right? Like northwest, southeast. And then you can find the entirety of the toe. Then no stone gets unturned, right? So as you're doing that and you're exploring all these different compass locations, you're like, oh, here's a band that's a little bit more resistant. He's reacting to this one a lot more,
Yeah, because you can feel it.
right? Because they're going to react to tension.
Yeah.
Right? Tension in the body is kind of going to give you that pain sensation. If they don't react to it, there's no tension, or you're not pressing deep enough. Right? So just poke and prod until you get, you see how he just gave a little, his body clenched a tiny bit? So that let me know, hey, we're on the spot. And how much time do you want to spend on the toes? Right? But if we have the chopstick, we could get really in depth into here. That's
Yeah, that one's got a charge to it.
So the charge Brandon's talking about, it's just like a searing, like a sharp electric sensation.
Yeah.
Like when you're on that tension band
Oh, no, that's fine. I think that's useful.
and you're taking them to the 7, 8, 9.
Yeah.
Can't give it so.
Oh!
This has been a long time in coming.
Easy.
You guys should see us at our teachers' conference.
Yeah, that was pretty mild.
You see, I work in a clinic where it's all very quiet. And if clients heard that, I don't think they'd ever come back.
It's good marketing.
They go running, I think. Yeah.
I always just have a non-judgmental frame of mind. It's not that I'm screaming out of pain.
No.
It's usually repressed anger.
Yeah.
And it's just, I can feel it and I go, oh, I can do that shit.
Usually anger, if you have a lot
it's
of anger and
quite tight up
frustration,
there,
right, it's
isn't it?
usually the side leg band that gets congested. So then we'd have to work from the pinky toe, because this is the root of that side leg band. And isn't that interesting? This is the only one that didn't click.
Yes.
So he's the tightest right here.
Yeah.
This one didn't click, which means there's not a lot of movement in there, right? So we have to work out the tension, and probably it's going to release, and you'll hear that pop.
Can I ask how you click the toes quite quickly, and so does Brandon, so what's the right technique for that?
It looks quickly, but we're actually doing it slowly and
Yeah,
controlled.
but what I mean is I don't know how to click the toes. I try and not often
You can do it a couple ways.
successful.
You can just grab it like underneath,
Yep,
and then
pull.
pull straight out.
Yep.
But you see I gradually
Yeah.
increase the pressure.
Yes.
So we have tools which we're going to learn, but you can just start with the fingertip. This first bone it can be quite sharp. It looks like an arrow tip. So you can be quite precise. It is better with tools, it'll save your hand, but you can see he's just a little bit reacting here. So we know we're on to
That still
something.
hasn't clicked, has it, that toe?
It has not yet. If I had a towel, I could get a more
Yeah.
firm grip. Yeah, and this is why it's good.
Sheet.
Yeah, I could do that.
Get the sheet.
Stubborn.
Oh, yes.
So if we remove some of that
That's so
tension.
satisfying, isn't
It
it?
is, yeah.
Some people don't like to have the trunk lick.
Some people don't. Okay, so you see he stood up a little bit, so he's just like, oh, I'm on the verge of something maybe.
Yeah.
Right? But if you felt what I feel, you're going to feel there's quite a bit of resistance kind of deeply in there.
Mm-hmm.
So if you want to press, get a strong grip. They don't hit the board, they say push through the board, punch behind the board, right? Same thing as you're kind of assessing tension. You
Yeah.
can't feel the tension so much on the surface of the skin, but you can feel it deep,
Yeah.
right? Because it's in the muscles, it's in the tendons, in the ligaments. It's not on the surface so much.
I can't feel it. I'm
Yeah,
not pushing
go
hard
deeper
enough.
and slowly. So get a nice grip and then just sink
You mean
very
down
sharply.
here?
Yeah. Now remember, as 2 and 3 people have worked on it, that tension is
Yeah.
going to slowly dissolve anyways. So, it'll feel differently for the 6th or 7th person than the first person.
I'm not pressing yet, Brandon.
But you're also using a sled finger. So notice the difference. Like if you ever see like a snowmobile, the front forks are flared up, right? That's so you can glide over the snow. But you can't really find tension so well with a sled finger. You have to kind of bring your finger or thumb from a sharp angle. And that's why it's super important to have very short nails, right?
Yes,
But you have to come from a higher angle to feel that. You don't feel it as much this way, and this will also damage your thumbs over time.
Yeah.
Right? Like I see people who work in the massage profession doing this, and they're going to wear out their thumbs in less than 5 years. But if this will actually strengthen your thumb over time, and it's more precise, it's more stable. So try to get that one. You really want to be on the east and the west. Right, close to the nail. Are you able to find it? I feel you're just slightly off the mark.
Yes.
So let me just show you exactly here. All right? So right there.
Okay.
I need to do that too.
It's right in that. So bring your thumb a little bit more this way. Yeah. Okay. First, when you line up your fingers,
got it.
then check in with your client.
I got it, yeah.
Wait till he's exhaled, then deep breath together, and really only compress on the out breath, because he releases on the exhale, right?
Yep. I could feel it then, like
Yeah.
a little line.
Make sure once you've lined up, you pause. Check in where they are in the breath cycle, and then wait till the exhale before you
You
squeeze.
feel it go forward with your thumb, you can feel it.
I feel clumsy.
Yeah. You can squeeze a little bit more.
I am.
Yeah, you found it, because he's reacting, right? He's a little bit
You can
going.
feel it like a little line.
Yeah.
Like a
He
little
said
bit
it's about an
gristle.
8. And actually, as you're doing that, this is getting softer. This is why it's so important to release the roots, right? Because it makes your job so much easier as you're coming higher up the chain. That's Jeremy.
Was not.
Yeah, give it some reward. Now, right about here. Notice the difference? So this is like a guitar string, right? Twang, twang, twang.
standing up.
But now we can check the rotation. So this 80 degrees now. And then how far this one? Oh, this one's almost 90 already, right? It's like the edge of a box. Right? Look how far that bone structure goes. That's great. So then You know, we want to just continue up from there. Oh, we found something here. You might even want to hold his leg in this position, and then you can get an elbow come down like this. If you're having a hard time with your thumb.
You just use your weight, Terry, or do you actually put a lot of strength when you're doing
I don't push it off. You feel my hand, it's so loose here.
Okay.
Right? I'm very soft.
Right.
Because you can't fight tension with tension. When you're clenching like this, you lose your connection with the client. Okay. You block yourself off.
Gotcha.
And then you cause tension in your own body. So you just see everything so loose. And then I just sink my weight. I don't push. I just go soft in my knees, and I just let gravity do the work for me. You know? It's so much easier. Then you don't tire out. All right. Come into here. Okay, so feel, there's just a little bit of an anomaly right there. And that's one of those 3 points that Brandon was saying you want to check in, right? Those are like assessment areas.
I didn't feel it.
Which were the 3 points?
Yeah. So here, and here, and kind of here. Almost like a semicircle, right? Area.
On that outside. That outside's been giving me problems for quite a few years off and on.
Oh yeah, I can feel that one.
What I would do in this case is I would put an elbow in there. So make sure is, I'm going to do this there. Okay, so here's the outline so we know where it is. And then here's kind of where we need to be. So you find it with your fingertip. Again, look at your elbow point. Have your eyes follow. All right. And then you can place it right on top. Check in with your client. Deep breath. You can lever the foot a little bit to just take a little bit of that crampiness there away. Getting close to his threshold. Okay, come out, check the rotation. As you're doing that, you should see the foot should be a little bit more mobile. Okay, and I'm getting more information as I'm doing this. I'm gleaning information, which is softening up, which is remaining rigid. And that's going to guide me to the next area. Give it some reward. You can't be all pokey all the time, right? There's a warm-up, then there's the excavation, and then there's the reward. You got to get all of it. If it's all excavation, your client's just going to be irritated, right? You have to, it's like the velvet glove and the iron fist, right? You have to have the velvet glove. And I feel the pressure has to be gradually increased over time. So if it takes some 10 seconds to exhale fully, then, you know, on the first second you're at a 1, and then 7 or 8 seconds into it, then you're at the 7. And then you kind of hold it at 9 until he's completely empty of breath, right? If you just go straight from a 0 to a 9, you're just going to shock them too much, and that's just too irritable, right? You have to be kind of predictable in your motions so they can anticipate how deep you're going to go in a certain amount of time, so that way they can relax around it more. If you're too choppy, if you're shocking the system, then it just brings their defenses up, and they're more prone to clenching up and resisting it. But if you're a little bit predictable and controlled, then it's easier for them to, you know, accept and surrender. Does that make sense?
Mm-hmm.
9.9.
Whoa!
Being?
That was probably probably a good release. We can kind of see, check our work. Look how much this softened up now. You feel there's a really nice depression right here.
Terry, can you just show me without the tail where you were pointing?
Yeah.
With your elbow.
And here, here, and here. I
Right.
still feel there's a little bit
3
there because
points
he's
that- yeah,
he's
Brandon
reacting
showed
to
us.
it. Yeah.
Yeah.
So, you know, maybe I'll just go down and check my work again.
Yeah.
You know, did I miss some in the toe? I think there might still be some deep tension in that toe. Just to scream if I'm going too light, Brandon. Just gonna give you a gentle caress here. Just let me know if you can feel anything. If you could just give me some sign that I'm in the right spot.
Yeah,
Now we'll just give it some love.
it's needed it for a long time. I get a lot of puffiness and swelling on the outside of that ankle, and then when I do a lot of gardening on my property, and it's quite slopey and everything, that whole ankle will just swell up. I've had problems with the ankle for many years, but it's always that outer of the toe band.
But on the same token, as I'm doing the outside, you know, because I've got my pincer grip, I can also feel on the inside, right? So, you know, I'd want to flip him over as well too and do the same thing with my elbows, with his leg in this position, you know, the knee out. But we're definitely making a good improvement. It does feel a lot spongier on the outside, and then still rigid. If you want to compare, you'll see there's some indentation here, but there's some rigidity there.
So someone could come back in 3-4 days' time and you can rework on that foot.
Oh yeah, absolutely.
Yeah, because it's quite a lot for initially when you're not used to this, isn't it?
Yeah. Like in class, you're going to get massaged every
Yeah,
day, right?
absolutely. But a new client coming
Yeah.
along,
Yeah,
never had this
usually
before.
schedule.
Yeah.